Good day, I am Katrin Q. Matiwani, student nurse at Davao Doctors College, and today I will be performing my return demonstration about the basic life support of the adult, child, and infant. So first, the adult and child. Basic life support is an emergency management provided by the first responders and public safety personnel to people who are experiencing cardiac arrest or an obstructed airway. To begin, I will first scan the area and check the environment for any hazards. Okay, so that can harm us, such as fire, falling debris, or chemicals, because if we also do get injured, then we will be unable to help the patient. So now I will be donning my PPE. It's also crucial, such as gloves, gowns, and masks. So after that, ensuring the safety of the scene, I will now check the level of responsiveness by tapping both shoulders and calling out names on both ears. Hey, hey, hey! Are you okay? Hey, 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 hey! Can you hear me? And after doing that, I am also assessing if the victim is breathing or not. So now that now that I see that the patient is not responding and breathing, I'm going to activate the emergency response system and to do that as a bystander to call for help immediately. Hey, you in a black shirt! Call 911 immediately. We have a patient here in need of help. So now I'm going back to the patient. Check the patient's pulse and breathing. Remember to loosen and constructive clothing and check the patient's mouth for any objects that can obstruct the patient's airway. Now I'm going to check for breathing and circulation for 10 seconds. 1, 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Okay, the patient has no pulse, is unconscious, and not breathing. I will now perform the cardiopulmonary resuscitation, which combines rescue breathing and chest compression to temporarily pump enough blood to the brain until specialized treatment is available. And now I will be performing CPR to deliver proper chest compressions. First, locate the chest area of the patient. And also, place the heel of one hand over the center of the chest and interlock both hands while leaning towards the patient and strengthening elbows. So now I'm going to start 30 chest compression with a depth of 2 inches. 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1. Okay, so after doing compressions, immediately administer 2 rescue breaths to the patient with the help of a wearable device while covering the patient's nose and also tilt the head to open the airway. Okay, continue doing 30 compressions and 2 rescue breaths until an emergency responder arrives, and it should be 32 compressions ventilation ratio. So after that, after 5 cycles or 2 minutes of CPR, reassess the patient by checking pulse and breathing in not more than 10 seconds. After doing that, I'm proceeding with the automated external defibrillator, which is a medical equipment used to help those experiencing silent cardiac arrest. First is to turn on the AED, and after that, scan the patient's chest, then place the pads. One will go over the upper right of the chest, just below the clavicle, and the other one is beneath the patient's axilla, just below the navel line. Okay, I will turn on the AED. So now the AED will start analyzing the heart's rhythm and determine if CPR is still necessary after attaching the pads. The AED will also deliver an electric shock, so individuals present should clear away safely. Okay, everyone clear? So what happens, what we're going to do is that we deliver in shock in 3, 2, 1. So shock delivered. So, after the AED will tell us to resume performing CPR for how many cycles while analyzing the heart rhythm and producing a shock if necessary. And after that, reassess the patient after 2 minutes if ROSC is achieved. Place the patient in a recovery position, and if not, repeat the procedure. And lastly, don't forget to document the procedures so that the procedure is proven done, and also the time and the resuscitation started up until it ended. Next, proceeding to the infant CPR. So imagine that this is a baby. So basic life support of an infant is an emergency management provided by the first responders and public safety personnel to people who are experiencing cardiac arrest or an obstructed airway. To begin, determine the baby's APGAR score to evaluate the newborn's transition to extraterrine life. Let's say that the baby's APGAR score is 4, which is considered as burning, and the infant needs immediate resuscitation. And after taking the APGAR score, check for responsiveness by rubbing the sole of the feet or rubbing the back of the baby. And if there is still no response, position the baby on his or her back and call out for help. Hey, 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 baby. Are you okay? Hey, 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 baby. Can you hear me? So next is to open the baby's airway by using a suction valve to remove the secretions found in the baby nose and mouth. And now, since the baby did not respond to the stimulus we did, so we have to perform positive pressure ventilation. Or the PPV. Two types of PPV can be invasive with the use of ventilator, or the non-invasive one, which uses a pediatric bag mask. And I'll be using the pediatric bag mask. Now we will be performing the CPR. Place the bag mask over the baby's mouth and nose, and position the hand on the rim of the mask to ensure the pressure seal. When delivering oxygen to the baby, be sure to maintain proper pacing. Wait. 2, 2, 3, 2, 2, 3, 2, 3, 3, 2, 3, 3, 2, 3, 3. And PVV should be done for about a rate of 4 to 60 ppm and do for the chest rise with each bagging. After that, have someone attached to a cardiac monitor and pulse oximeter to keep track of the baby's heart rhythm. If there is no increase or the heart rate after the performing PPV, then we have to proceed to perform chest compression and rescue breaths. So now to perform chest compressions, you can use either a 2-finger or 2-thumb encircling the technique. So here, and But for today, I will be using the two fingers since the patient is a baby and locate the center of the chest just below the nipple. Begin 15 chest compression and 2 rescue breaths, and remember to only press down about 1.5 inches to prevent harming to the baby. Now, I will begin the chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1. And now, still at the, if the heart rate is still less than 60, continue chest compression and assist in intubation to allow the air to pass through. If the heart rate is more than 100, do pass resuscitative care for continuous monitoring. And now, lastly, I will now document the time, procedure done, and also the response to the treatment. That's all for my return demonstration.